control it? Hold on.
Hi, all right. I think we're live. We have currently 34 people in this session. Good morning.
Good morning, everyone. My name is Ada Care, and today we're going to be presenting a very special topic with some local providers, community health workers of Delaware. Welcome, Dr. Gonzalez, Dr. Santiago, and Adriana, Christiana Care community health worker and leader. And we're going to get started. Just for a test, Lourdes is muted, so she's working on that. We'll work through what we have to in terms of technology. Lourdes, I might have you call that number 504-5299 if you can, and to ask them to help us in our session. But I'm going to get started. Listening, connecting, and inspiring change. Let's see here. Okay, and this is a Community Voices breakout on women's emotional wellness with a focus on the needs and barriers for Hispanic and Latinx women in Delaware. This is me. My name is Ada Care. I'm a psychiatric mental health nurse practitioner at Christiana Care Center for Women's Emotional Wellness. That's me and my sweet daughter, Grace. And I would like to start off by asking Adriana to introduce briefly herself, her areas of expertise and personal insights. Adriana, take it away.
Yeah, of course. Hi, good morning, everyone. I was able to see a lot of familiar names and faces. So for everyone that does not know me, my name is Adriana Vivero Sosa. I am the program coordinator for the Health Ambassador program at Christiana Care. It's a grant funded program that we're boots in the ground assisting caregivers who have patients or who have children under the age of 5, and we link them into resources. Within my program itself, we assist patients who have children under the age of 5, and then we address different social determinants of health barriers that perhaps they might have. Also, I'm the co-chair for the Women's in Consortium. On side of my professional role, I am a mother of 4 wonderful children. I am also a DACA recipient, which means I was brought into this country with the Deferred Action Act and with childhood. I like to address that because there's many layers to peel among legal status overall. Within the Latino community, I'm here to be an advocate and really tell you guys different barriers and different things that are currently happening in our community. And I want to make sure that you guys are aware of what's going on with mental health. So if we could go to the second slide, Anne, please.
Yes.
Thank you. All right. Awesome. I know it seems really small, a picture, but this picture really resonates with me. It has a lot of important information. So mental health is a Latino issue too. Overall maternal health is also an issue too. So a neat thing about this picture that is telling us about that, only 5% of United States licensed psychologists are able to provide those services in Spanish. Another thing that resonates with me is that 20% of the Latino do not have any health insurance overall. Culture differences. Only 7% of licensed psychologists identify themselves as Latino or Latinx. Stigma behind mental health. There's currently a lot of stigmas among the community that I serve and that I am part of it also as well. Because there's a lack of information and a lack of education because everything has been brought to word by mouth, and there's different stigma. One is the first thing that a lot of Latino women happen to say, I'm going to go and see a therapist. What's the first initial thing that it says? Estás loca. It translates to you're crazy. So we really want to make sure that we break the barrier among Latino women and Hispanic women among what is mental health, and really break down what is maternal health and mental health. And also to tell them it's okay, está bien no estar bien. It's okay not to be okay. It's okay for you to ask for help. It's okay for you to break the cycle within the vicarious trauma or the trauma that you have. Another key component I would like to address is that maternal health, among all the presentations that we saw today, Latino women have other trauma carrying it from their culture, from their background. So yes, as you've seen in the statistics, we're falling right behind among maternal health and infant mortality. But then we have many, many layers to peel among that. One thing that I encounter as a program coordinator for the Health Ambassador Program is that by tabling, we encounter a mom who was currently expectant at that time. She was in her third trimester. She let us know that she had a medical condition and the baby had the medical condition too as well, which they really did not give enough hope for the baby to survive. During that time, mom was dealing with the medical condition of the baby, and also she was going through domestic violence herself. The baby was born. Unfortunately, the baby passed away in the hospital within minutes of giving birth. Another thing that happened was that there was no one at that location to provide her with bereavement support in her language. She did reach out for resources to us. We were able to connect her to a mental health provider. During that time, the provider had a waiting list. So it took many weeks until she was actually seen by a provider. Mm-hmm. When she actually saw a provider, she realized that the provider did not speak the language. So there was a language barrier. And also there was a culture barrier because mom did not, the physician did not understand, the psychologist did not understand what was going on with the culture because mom kept referring the baby as a present because in the Latino culture, you talk to past family members and present. So there was that big barrier within the cultural differences that really did not help build that rapport with the physician. So then mom discontinued the care and was really not able to thrive among mental health. So there was many barriers that were happening in this circumstance. And I just want to bring awareness that within our own community, there's many layers to peel and many different things happening. And I do want to take this time to really recognize and see what's going on in your state. What are you addressing? What are we doing to really address the Latino mental health community overall? And I'm going to leave this space to my colleague, Lourdes Santiago, who is up next for a presentation.
Thank you, Adriana. That was a beautiful, and for sharing the story. We need to hear her story. We know that, and so we appreciate that very particular and sensitive interaction that you experienced and shared. Lourdes, I know, is having a bit of issue in terms of getting her her microphone working. It looks like she is working with Jennifer currently. And so what I might do as the moderator is continue. Lourdes, if you're able to get on and speak, but she did give us slides. So I'm going to continue with some of what she was sharing in terms of very important prevalence data in terms of perinatal mental health disorders in Latino women. Where she shares here a very good reference that we will be putting into the chat, both in Spanish and English, for everyone to be able to see. But where she references, in terms of perinatal depression, 1 in 7 women are affected. And in the Latinas, it's 37% more likely to experience in comparison to other racial groups. That there seems to be a higher risk for Hispanic women of developing postpartum depression than non-Hispanic women. And there's less of a probability of being diagnosed. And being a perinatal mental health provider, I can tell you that is always a big statistic and something that we're trying to affect, which is not just the amount of women affected by it, but getting them to proper treatment, diagnosis, and then treated to remission. So it's being experienced higher in this group. And in terms of anxiety, perinatal anxiety, which currently there's not even such diagnosis in psychiatry, but we see it, we know it to be true, and it ranges from 13 to 21% in new gestational and non-gestational parents. Lourdes, I don't know if you have access yet. I'm going to take a look back at the screen to see if you do. Looks like she's trying. And I'm not going to tell your personal story, Lourdes, but I'm going to continue just with the information you shared. Risk factors for developing perinatal health disorders are shared here in terms of a history of mental health disorder, family mental health disorders, adverse childhood experiences, which the DHMIC has done a lot of work exposing and exploring over the years, experiencing unplanned or unwanted pregnancy, which we know greater than 50% of all pregnancies are that, complications during pregnancy or delivery, relationship issues and stress, social and or environmental factors, and experiencing parenthood as a young person during adolescence. Adriana, if you could cover this next slide, do you feel comfortable speaking to that, just so that I don't do any pronunciation snafus, or I'll try. Adriana, are you able? Oh, they're on the phone together. Okay, I'll continue. And so what she's describing here, just being cultural values and stigma about mental health in the Latina community, lack of access to care and or support, and then very specifically language barriers also being an issue. What I'm going to do is jump over to Dr. Ada Gonzalez and introduce you. Dr. Gonzalez, feel free to jump in and to start to speak. And session number 2 breakout, we will have Lourdes tell her story.
Hello. So yes, my name is Ada Gonzalez, and I am from here, there, and everywhere. I was born in Cuba, left when I was 18 years old via Spain, lived there for a few months, and then I lived several years, more than 10 years in Costa Rica, more than 10 years in Mexico, 2 years in Germany, and in the United States, I have lived in Michigan and Texas, which are kind of like 2 foreign countries too. And while in Mexico and Costa Rica, I was living at and working at universities that had people from all parts of Latin America. So I'm very much familiar with the whole differences, cultural differences of Latino people, because we are not all the same. And that's one problem that sometimes other mental health people don't understand. Why, if one person is Latino and the other one is Latino, they are so different? Well, because they are not from the same country, and every country has their own flavor of things. So on the note, I have been a licensed marriage and family therapist for more than 30 years. So I have worked with all kinds of issues. And people always ask me, so what is the most effective flavor of therapy that will be helpful? And my answer always is, it really depends. Because for some people, depending what they are bringing in, maybe the best thing will be, let's say, cognitive behavioral therapy, or maybe emotional intelligence, or maybe positivity, or maybe structural family therapy. So because I'm old, I have all this white hair, I have had so many different trainings that I can take from my toolbox whatever will be better for the client. But above all of that, what I have found in research and reading and training and all of that is that the most important part is how the client and the therapist connect. Mm-hmm. So if you cannot make that connection with the client, the therapy is not going to be as successful, doesn't matter how much experience you have of what you are using as your main way of doing therapy. So making that connection is a lot easier when you speak the language, when you have been in the culture. And one of the barriers we find going on with that is that, for example, if for Kent and Sussex County, where I practice in private practice, there is only one or two of us that speak Spanish that are Latinos. There are a few others that speak Spanish, but not as well, and the connection is not as easily made. So that's a problem. And the other problem, as Adriana was saying and Anne was saying, is besides where people are from, a big issue is where they are in their acculturation in this country. Can they speak any little bit of English or not? Can they drive or not? Are they first or second generation? Are they legal or illegal? And can they drive? You know, a lot of Latino women don't know how to drive. So they depend on family members or the husband that might be working full time and might not be able to drive her to have access to mental health. And so that is a problem. And the other problem is all those ideas of, oh, it's just a case of nervios. You are just nerviosa. That's for anxiety. You are just nervous. You know, it's not a big deal. Or the whole bombardment from everywhere, suegra, abuela, comadre, you know, of what the new mother should do with the baby, until the mother is, I cannot do anything right. I must not be a good mom because everybody is telling me that intuitively I should know what to do, but yet everybody else is telling me that I am doing something wrong. So, you know, being able to understand all of that and to help the clients be consistent in the way that they come to us, so that, because that's another big problem, they come one or twice and they either don't have money to pay and they are not on insurance, or they don't have transportation, or they think, oh, I'm okay because I went twice, or because have been taking medication for a month now, I can stop everything. So those cultural barriers, if we as therapists understand it, is a lot easier. And if we can make that very strong connection, that would be the best therapeutic bond that you can make. And back to you.
Thank you, Dr. Gonzalez. I'm curious, what do you find in terms of evidence-based treatment options that you have been able to successfully use when serving the Latino population that you serve?
Well, we don't have too many evidence-based on Latino population. We have evidence-based based on general population.
Yes.
So, for example, cognitive behavioral is one that I like to use a lot with a lot of my clients. But when it comes with the Latino population, you have to tweak that, because the Latino mind and the myths and the whatever they are coming from that is telling them that something is going to work or not to work, you have to take that into consideration. You cannot try to have them change the way they think in such a radical way that then they will be out of their culture, because then you take away their support. So that's why I say you have to try, yes, some of those very good evidence-based like cognitive behavioral or like structural therapy work in the general population. And for some Hispanics, Latino people works too, but not always. So you have to be able to tweak it. And that comes with experience, unfortunately. Everybody else that is not 70 years old as I am might not be able to do it.
We'll look for you to lead, Dr. Gonzalez. Thank you so much. Yes, very important. What we would like to do now with our group, Lourdes is still on mute. I apologize, Lourdes. We're going to have you speak and share your story in the next time that we break out after the noon session. And so please come back to listen to Lourdes's story and to hear from her directly in our next session. I'd like to be able to add some people to this conversation. We'll see if I succeed as a facilitator. Hazel Morales, I'm trying to add you in. Nancy Duran, Cynthia. Okay, I think I can add up to 10. Ms. Strong and Ms. Silva. I'm adding everyone. We're looking to hear your voices today. What is it that we've spoken to? What is it that you feel you need to share about Delaware and the barriers to treatment for Latinx women? Let me see. Maybe I need to do unmuting. I apologize. I added you. This seems to be our issue today. Adriana, are you able to unmute yourself?
Yes, I can unmute myself.
Okay, I'm trying. I added everyone, but now everyone looks muted to me.
We have to love technology. Well, hopefully this summit next year will be in person and we don't have to deal with this issue. We will work in progress and make sure that everyone has a voice. So if you're able to mute yourself, I invite you to mute yourself. So please let us know what you think. I see a lot of people that are with boots on the ground, not to point it out, but I do see a lot of home visitors. So what do you guys have seen out in the field? We are curious to know.
We can use the chat function as well if we're having trouble with unmuting. I'm continuing to see if there's a way I can do it on my side while we go. Does anyone feel comfortable chatting in comment that we could share and discuss as a panel?
Please don't be shy.
You know, I think one thing I would like to talk about as a panel is deep listening and understanding of the women that we serve. And I think that we heard that also this morning about deep listening, not just hearing or advising in terms of what we think women need, but really hearing them for what they're experiencing in and of itself is healing, being with the woman and hearing her voice. So I did want to echo that. Lourdes, she says she'd like to add that being able to have forums for Latino women to speak about their experiences is also healing and insightful. Yes, a community voice ongoing after this summit would be a beautiful thing. A recommendation we could bring back to the DHMIC would be just that, Lourdes. Kimberly O'Neill, with so few healthcare providers that speak Spanish, we are able to leverage technology to access virtual healthcare providers to meet the needs of our Latinx community. You have a question mark there, but I'm going to say that as a statement. Yes, Kimberly O'Neill. Yes, we should be using technology also. And Lourdes adds also that in a way that we have pulled community together is through the Christianity Care Health Ambassadors that have done community baby showers. Adriana, I know that you could speak to that as you've led them and your team. Thank you, Lourdes.
Definitely. Thank you for pointing that out, because the main component about being able to build that rapport with the community is to be able to be a part of that community and make sure that the community understand that you have genuine intention of helping them and not judge them. And you're here to work with hands within their healthcare overall.
Have you found the community baby showers to be successful, Adriana? And
Yes.
in what way did women say it was helpful?
So with our community baby showers and with our chat and choose, our services usually last more than expected, because this is the time where community members have a voice. We are able to provide them with a voice, and they can network with other moms and really make sure that they're on the same page. They're struggling through the same components, but they're not really vocal about it, or they don't know how to express, or they don't know what is going on with them. They don't understand what is depression. They don't understand that they're at a risk 1 year postpartum of still having or being able to be depressed or have depression, or they don't understand what are baby blues. So being able to have everyone in one place and really able to advocate and educate them, it has come and bring them into a big community where they are helping each other, and they're able to connect with us at any given point into their child is the age of 5. So having being that bridge between healthcare and them, I think it's been phenomenal to be able to build that bridge for them and be their advocate and bring their voice, because once again, a lot of them don't have a legal status, so they feel like their voice have not been heard. And every time we have a community event, they're like, "Will you be our voice?" Because I come from that community. I want to be there to advocate for them, because at one given point, I could be that part of the community. It could be my neighbor who I'm advocating for, or my family members too as well. So this really hits home, because I want to make sure that we're providing the correct resources and providing that bridge between healthcare and what else are we doing to assist them, and what else are we doing also to build that ladder and build that work reinforcement to help physicians or psychologists to help other Latino women or Latino overall parents.
And what we have seen too is that where you're leading the event and you have established trust there and established community, Dr. Santiago says, and then having her come speak or having me come speak on maternal mental health, perinatal mood and anxiety disorders, then we're allowed into your trusted space to share this health knowledge, to increase their health knowledge and awareness so that they themselves will be able to speak out for themselves when they feel that something is just not right. They're not used to being that nervioso, right, Dr. Gonzalez? They're not used to that. And what is that new thing they're experiencing? Not normal. If it's depression and beyond 2 weeks, not normal. So we appreciate both that connection with the community that the community health workers establish, and then inviting us as providers to be a part of that discussion. It's a beautiful marriage that we look to grow. So I'll ask everyone to join the main session. We will have another opportunity to speak at 12:30 to 1. See everyone there, and we will have Lourdes on microphone.